Brenda wanted to do all my medications, and I just wanted to be more independent than that. I needed help. I really did, because I take medications 4 times a day, and there's about a dozen different ones, and it's really very complex. And when I first came here, especially, I would make mistakes, big mistakes, and that wasn't very safe. And so she insisted that she take care of all my medications, and I felt, I should be able to do that.
And the husband said, as long as I can use this thumb to work the remote, and he meant it, I want to live, do everything. So if that was his desires, that's what we would do. We would do everything to keep him comfortable and alive.
There was one question about giving antibiotics. Our sister felt that might prolong something. She didn't think it was a good idea. And we said, fine, then no antibiotics. And then the nursing staff explained to us that basically an antibiotic isn't going to prolong anything, but should she get something like a bladder infection, an antibiotic could help her and she wouldn't have the pain and discomfort.
How much help can be offered to someone who prizes independence? How can we respect the wishes of someone nearing the end of life? What kind of medications are appropriate if a family doesn't want to prolong a loved one's life? These are the kinds of situations in which personal values are often in conflict. Yet, these are exactly the kinds of situations that residents, family, and staff have to face each day as they make decisions that will affect the quality of life of those who are served by the Internext group. Decisions that are difficult to make because in most cases there are no perfect answers. Because it is our task to understand and respond to the values of our residents, what is important to them, the Internext Ethics Service has developed a set of guiding principles and a process for ethical decision-making to help staff, residents, and their families make the kinds of decisions that will best honor the values of the people we serve.
We are here to really focus on the patient. What does the patient want out of this? And in our scenario is that the patient wants to be comfortable.
We look to the resident first. This is an independent living facility, even in assisted living. The resident is the key in terms of decision making.
I tell the resident when they come in that for the most part, I try to stay out of their life. I say I don't want to meddle. I want to be in the background.
Because we know our residents very well. And we not only know that they live in room 323, we know the fact that they don't like to get up early and that they come down for dinner in the evenings and they go out to Candlelight Pavilion and they play bridge every Thursday.
The first thing that comes to mind for me is finding out what the values are of the family members that we're helping.
And the family is one of the most important parts of this team because they know this resident. We may know them for a few years. They've known them for many years and grown up with them. They know their idiosyncrasies. They know their likes and dislikes.
They may need a lot of information on medical diagnoses and options and things like that. So they need to be able to make an informed decision, and that's where we come in and are able to provide that education and information for them.
Those are the principles that guide us as we work with residents and their families to honor their values, understanding what is important to them in order to make the best decisions possible about their care.
I think the hearing impairment is probably why he withdraws a lot.
These principles come into play with the very first contact a prospective resident has with any of our staff.
On the onset, of course, my goal is to provide them information about manner living, but that being the main goal, the avenue that I take, of course, is to see what their needs are and what they're looking for.
We're all sensitive to our need to keep our ears open rather than to say to the prospective resident, here's what we provide, and this is what you need.
I walk as a companion with people through the transitions that they make. So I'm invited to get to know people after they've made application, basically. I go out and make a home visit if I can.
And then I ask them, and why Claremont Manor rather than some other place? And they will begin to talk about their values at that point. They'll begin to talk about their worries. They'll begin to talk about what's important to them in terms of their everyday living experience.
I really keep an eye on what I would call health issues, more broadly understood, like emotional health, psychological health, relationship health. And I want to be aware if someone, for example, would have a short-term memory problem that would be significant.
We also make them aware of the wisdom of having advance directives, certainly having a durable power of attorney for health care right at the start.
It's an advance directive. It's a legal document where where a resident designates individuals who are then empowered to make medical decisions for them in case the time comes that they can no longer make those decisions for themselves. And in that document also they specify, the resident gives direction as to what type of treatment they want or what they don't want, and they can make that as specific as they desire.
In talking with all of them, there's a feeling that they really care and they really listen to what I say. And I have the feeling that if I needed a specific thing that nobody else needed here, they'd try to see that I got that.
More than anything else, staff members, from a director to a maintenance person and at every level in between, listen to residents. The highest value possible is placed on meeting their needs and involving them in the decision-making process. Listening and meeting residents' needs is especially important when the time comes to consider whether a resident may need to transfer from one level of care to another, from independent living to assisted living or skilled care. The Internext Ethics Service has an ethical decision-making process in place when difficult decisions have to be made. Through this process, staff works with residents and families to gather all the facts relevant to the situation, identify values that may be in conflict, explore all the options, and then finally make a decision.
In transferring from one level of care to another, I want to do that slowly because I've learned the hard way that if you go bombarding these residents, it's not kind.
We try very hard not to make it an institutional approach because everybody comes at deciding what's best in a different way.
Jean and Clara are residents at Villa Gardens. Staff met with them, as they do with all residents on a regular basis, to see how they're doing. Staff listens, and one of the things they listen for are signs that a resident may not be receiving the assistance they need.
He was not too strong himself, probably.
Right.
So he went and got help.
Good.
And immediately I was on my feet again, and that was all.
So she's already admitting that she's having falls. So there might be, sometimes there's a relief if we say, well, you know, how about if we send someone in to help you with the bathing? Maybe there's a way in which we can still remain in your apartment, but if we send in services into your apartment where we can help you with your bathing. My sense is just from her that she wanted us to know because she's really asking for some extra help. She wouldn't have let us know if she didn't think she needed some help.
And we'll make contact with her and see if we can get our daughter in and see if she's known that she's falling as well.
Kind of thing, but even maybe just having some home care services. Right. We bring in the dining room manager, who is the one that knows which resident comes in and out of the dining room, if they're eating their full meal, if they're asking for dinner 4 times.
The housekeeping supervisor is here. I'm going to ask her, does she notice anything when she's going into the apartment or any of the staff going into the apartment? Are they noticing that things aren't picked up, that the environment isn't safe?
At new employee orientation, that's one of the things that we stress, is that all employees are the eyes and ears of Villa Gardens. So as a team, we see how they can best stay in their apartment, because our goal, of course, is to keep people as independent as possible for as long as possible, and to, of course, treat everyone with respect and dignity.
Another resident issue that requires a commitment to ethics and values is when it's time for a resident and family to make important but often difficult end-of-life decisions.
There are some people that just expect that when death is imminent that we do something to help that, speed that along. There are other families that have very strong core values that are related to their religious background perhaps, or maybe just some ethical principle that undergirds their family. And so that's our job to find that out so that we can partner with them in providing care that their family needs at this point.
Our father died suddenly of a heart attack after having a lot of heart problems. And he was resuscitated and he was put on life support, and then we had to turn all that off. And Mother always said, I never ever want anybody to have to go through anything like that again. So I want one of these living wills and what have you.
The care plan is made by all the team in this care center. That includes a social worker, a dietitian, the activities director, nursing of course. We have a nurse that just does a lot of paperwork that this is all about. It's like the blueprint of this person, everything about them. We also have administration that comes up, and families are invited to this meeting.
We decided that if she were to ever have a stroke or anything like that, which they now think she's had, we would not want her, as Don said, to be force-fed, to be put on IVs or anything like that, because she'd made very clear to us that she never wanted anything like that.
First of all, we review their care plans and make sure what's going on, what issues are going on, mobility sometimes it could be a pain issue, what is going on. We sometimes get patients that are in quite a bit of pain due to the disease process. We evaluate it at the care plan meeting. How is that pain being managed?
Anything we've ever asked them to do, it seemed like they did, right away. They told us what was going on and why they did. Sometimes we questioned why certain things were done, and they would explain to you why they did them.
All of the people who are the Internext group have made a commitment to ethics, values, and compassion. It is a living commitment that honors each individual's values, recognizes each individual's uniqueness, and provides care and support. This living commitment enhances the quality of life for those we serve.
I think probably the most important thing is every time I have ever been here, dropping in any time at all, she's being treated like a person. It's not like she's just a thing there in bed, because she can't speak and she can't do anything but move her head. She's still Frances.